very brief overview about hypersomnia and multiple sclerosis and Parkinson's disease. It is for the basic general neurologists who maybe had little to no training in sleep during their training in their respective areas of expertise. And so I once again give a few cases of hypersomnia in patients with multiple sclerosis and Parkinson's disease. I talk a little bit more about hypersomnia in the context of narcolepsy and multiple sclerosis as well, as there is some overlap in patients with narcolepsy and multiple sclerosis. And they're thought to have an immune dysfunction or dysregulation. So I also give a brief overview of that. We also talk about the management of hypersomnia in patients with Parkinson's disease, and making sure that we address all of the possible problems or areas that could cause them to have excessive daytime sleepiness. I do a very brief review of excessive daytime sleepiness, what that means and what that number, anything greater than 10 is typically our cutoff for excessive daytime sleepiness. So I go through a rundown of that. And then near the end of the lecture, I talk about the treatment options, which there are many, there are vast. So I try to reiterate that there are several different types of options, and these are not all inclusive. But also I spoke briefly on the management of hypersomnia with regards to the treatment of using stimulants and the importance of understanding how to use the stimulants, but also to address any side effects that may occur with the stimulants and any, we call it black box warnings or adverse effects that the patient may develop. And that can include the risk of dependence or tolerance, and the fact that this is a medication that you want to make sure your patients are aware of may have some of the side effects.